sometimes it's difficult to convince a younger patient to protect their skin from the sun than it is from an older patient, because the damage, you don't see this damage until later on in life, correct?
Absolutely, and I think that's one of the challenges we face as dermatologists, is to really convince people that even though you don't see it now, it's going to happen later if you don't protect yourself. So it's critical that young people as well as old people, all of us from baby onward, need to protect our skin from the sun.
And we have a graphic that shows us how to be sun smart, and we're going to elaborate a little bit on that, Dr. Price. Give us some examples of ways that we can be sun smart.
Right. So I think the most important thing to do is to protect your skin in every way possible. So the first thing is to apply a sunscreen, to apply an SPF 30 to 50 broad spectrum sunscreen, to wear protective clothing, to try to avoid midday sun exposure, to seek shade when we can.
The worst sun is the midday, correct?
Right. The sun is the worst between 10 and 2, so we want to try to avoid sun during that time. Of course, we should be aware that the sun also goes through the clouds and reflects off the sand and reflects off the water, so we need to be careful about that. We don't need to get skin cancer and skin aging in order to get vitamin D. You can get vitamin D in a pill, you can get it in fortified foods. You want to not try to get it from the sun. Of course, number one, avoid indoor tanning. It's a big risk for melanoma and skin aging. And really look at your skin, become familiar with the lesions on your skin. If something looks strange, if something starts to become symptomatic, if it wasn't there previously and it's there now, get it looked at.